Hello to all my friends in Costa Rica. I'm honored to have been asked by Mrs. Chavez to talk to you briefly about the odyssey of CLN6, which started in 1993. Very briefly to introduce CLN6 disease, it is one of many diseases that initially we thought were due to the same gene, but now we know otherwise, that are characterized by visual loss, seizures, cognitive and motor decline, and premature death. There were some classic forms that were very well recognized at the time, CLN1, CLN2, 3, and 4. They have been supplemented by variants of the late infantile variant, and more recently, we know that there are now at least 13 recognized variants. At the time, we made the diagnosis by being able to see inclusions in white blood cells or in electron microscopy of skin. I made my trip to Costa Rica in 1993 before any of the genes had been identified. The trip was hatched by Mrs. Chavez and myself in Baltimore Harbor, and we planned to come, and I was hoping to collect material from the classic late infantile families in Costa Rica. After examining most of them at the APRONEP headquarters, we determined that they had a milder variant, and I hypothesized this was due to a different gene. We even went into the jungle to collect a very precious family, and the trip ended successfully with us shipping off samples to Boston, where the gene was ultimately identified in the laboratory of Dr. Marcy McDonald. So the Costa Rican families had a specific gene defect identified in all of them. We also identified a Venezuelan family that had a different type of mutation in the same gene, and there was a naturally occurring mouse model for this disease. I have to add here that the gene would not have been identified without the help of APRONEP, Mrs. Chavez, Doctors Luna, Pena, and Cambi, and other members of APRONEP at the time. To very briefly give you an idea of the pathophysiology, thanks to help from Dr. Jolly in New Zealand, who had sent us a sheep model for the NCL variants, not known which it was. Now we know it's for CLN6. We looked at the retina of a healthy 14-month-old sheep, and as you can see in the affected sheep, the retina was thinned and there were many dead cells. Soon thereafter, I stumbled across a medication that is protective to neurons and retinal cells, and that was being used as a non-analgesic at the time. And we found that this drug, when put in culture, helped cells by preventing cell death and keeping them alive. Subsequent to that, Paul Trippier, a very talented chemist at the University of Texas, sent us a number of compounds he had synthesized that were similar to flupirtine but had better qualities for use in humans. And we tested them, and lo and behold, found that they helped rescue CLN6 lymphoblasts from premature death and also lowered brain ceramide and cell ceramide, a toxic lipid which was found in this disease. So we started on a mouse model pilot trial, and as you can see, the mice are spastic, and we showed that putting this drug in water of these mice after a while reduced the clasping reflex and spasticity to normal. Also, these mice were stressed, demonstrating high corticosterone levels, but use of the drug restored it to normal. Also, in male mice, we saw that it normalized the abnormal and fast activity seen in this mouse model. Most importantly, we found that treating these mice, once we sacrificed them and looked at their brain, the accelerated death of neurons and the increased fibrosis were vastly diminished by this drug. And preliminary findings confirmed that this drug may be a viable candidate for treatment of human CLN6 disease, but of course, further work still needs to be done. And I thank you, and I want to show Mrs. Chavez her wonderful gift to me that I cherish and keep to this day. Ciao.